Hi everyone, we're going to be doing a hair transplant on our patient. Her goal today is to lower the hairline and have a more rounded hairline. So this is what we planned so far, and we're still going to shave and get everything ready. But we're going to fill in the temples all the way down here. We're going to make a beautiful round hairline. What we're going to show you next is the process on how we do it. So for her, because we really want to make sure we get everything exact, precise, we're doing FUE or follicular unit extraction. So we're going to take out each follicle individually, put it under a microscope, clean the follicle, and then re-implant it. There's 3 steps today. Number 1, we're going to harvest. Take the follicles from the back with no big scar, no scar. Number 2, we're going to take those follicles, clean them up, and make recipient sites or little holes. You'll see me do that. Number 3, we're going to take those follicles and put them in the sites. And when we put them in the sites, we're not just shooting them in there. We have to make sure the direction, the orientation, and depth is natural. The goal is when someone looks at her beautiful face and her scalp, they will never know what we did. All they will see is what she wants to see. Let's do it. All right, friends, we're starting our hair transplantation. The first step is we're going to do a nerve block on each side. We're going to numb the greater occipital nerve. To find the nerve, what we do is we palpate the occipital protuberance, which is right here. Then we palpate the mastoid tip. 1/3 of the way between these 2 points, the greater occipital foramen is where and that's where the nerve leaves. So we're going to get that nerve, a little poke on 3, my friends, one of the worst parts. 1, 2, 3. Numbing going in. And now we'll block on the other side. Are you okay?
Yeah.
Awesome. Other side, same concept. We feel the occipital protuberance. We feel what's called the mastoid tip. 1/3 of the way down is where our nerve is. 1, 2, 3, a little poke. And we inject the local. Excellent. Now we're going to do a ring block or a circumferential block around where we injected. We're going to give this a minute just to kick in. We're going to numb everything up, okay?
Okay.
Do you feel this, a needle or no? Oh, okay. Does that hurt?
Yeah, a little bit.
A little bit, okay, good. So the nerve block's kicking in there. And so now what I'm doing is what's called a ring block or a field block. I'm going to go around everywhere that we are going to harvest from, and this will help numb the nerve so we can do the harvesting without pain and less bleeding. In our mixture today that we're injecting, we have some special things. We have something that stops bleeding. We have something that shrinks the blood vessels, and we have pain medicine. You let me know if the pain becomes too much. Okay, we'll give you more IV. Sound good?
Okay.
All right. Hanging in there?
Mm-hmm.
We're using a vibration device to decrease the stimulation from the needle right now. The sides always hurt a little bit more. I'm going from where she's numb to where she's not numb to decrease the pain. Dab the bleeding, please. Good. So what we're doing now is now that we have the field block done, we're numbing everything inside where we're going to be harvesting and helping decrease that bleeding. So now we're starting the harvesting. My assistant Fung is helping me to do the harvest. When we look at the hair, we look at the follicle, and then we gently remove it. There's a follicle right there. The Fung will remove it for us precisely.
That just came out too easily.
Okay, you got it?
Yeah, it's right here.
Okay, so this is the follicle that we harvested. The key thing you can see is there's no transection. We have the full follicle, and you can see the bulb in the hair, and it's beautiful. Let me do another one and show you all. So we look at the hair right here. We gently go in. At the right angle, at the right depth, the right precision, Fung will take out the follicle. See how beautiful that is? Depth, precision, bulb. No damage, no transection. The key thing with this is keeping the transection rate low. That looks perfect, right, Fang?
Yes.
Excellent. Hi, everyone. We're going to be doing numbing. So when I do the numbing, I'm going to first block your nerves. So I'm going to block the supratrochlear nerve here, the supraorbital nerve here on each side, and that'll get most of the forehead. So then when I put a little bit of numbing in the forehead, you're not going to feel that. Sound good?
Mm-hmm.
So you're going to feel 4 pokes. Hopefully there won't be too much, okay?
Okay.
We're going to use a vibration device to decrease your pain. So to do this block, I feel the supratrochlear foramen, which is right there. I put my hand to protect her eye. And we're going to go straight in on the bone. 1, 2, 3, and get that foramen. Perfect. Are you okay?
Mm-hmm.
We'll inject the medicine. Perfect. Take another one. Now I'm going to get the supraorbital nerve, which I feel it's right there. There's the notch. The foramen is a hole where the nerve comes out from. 1, 2, 3. Straight on the bone. Do a nice injection. Then we'll do the other side. And this gets the entire forehead. Again, put my hand gently, you're going to feel that to protect her eye. And then feel the supratrochlear notch, which is really in the paramedian mid-brow position. 1, 2, 3. I feel it right there. Perfect. And I'll get the other side. I feel the supraorbital notch, which is sort of in the middle of the eye. You can feel it right there. I keep my finger to protect her eyeball. 1, 2, 3. Perfect. And now when I inject here, she's not going to feel much at all. So can you tell me if you feel any pain?
Right now?
Right now, do you feel anything?
No.
No, see, she feels nothing there. Perfect. Now I'm injecting the hairline first where I first did the nerve block, because that's kicked in. Whenever you're doing numbing, you always got to think, what am I doing now and what am I going to do next? And when you're thinking that way, the patient's more comfortable. It's not what I'm doing right now, it's what am I doing now and what I'm going to do next. Sometimes the temples can have some sensation until like numbing medicine kicks in. See, a good nerve block makes everything very comfortable. So we're continuing our block of where we're going to work, and then we'll get started with the site making next. All right, friends, we're making our recipient sites. I'm using microscopic magnification. We're making 3,000 recipient sites. I'm making them at the right angle and right orientation to prevent any issues. What we do is we make boxes to measure exactly every quadrant that we're placing grafts in, and then we have one of our assistants count for us to make sure we don't miss anything. And we go in order. The boxes help make sure we have uniformity in how we transplant, so we don't have any gaps. Gaps are the worst when you look at someone's hairline. I hate gaps. I get nightmares about gaps. So by doing the boxes, it prevents gaps. I'm going to do this 3,000 times. That's what the patient needs. That's what we're going to do. All right, friends, these are the grafts that we've made. They look beautiful and perfect. This is a 2-hair graft. You can see 2 bulbs here. So what we're going to do is we're going to gently place the graft in the recipient site. So we go in gently, put the bulbs down, and we gently place the graft just like that. The bulbs are all the way down. You can see the hair on the top, and it goes perfect in the angulation and direction that we want the hair to grow.